that overdose deaths in seniors have more than tripled since 2000, which is, I mean, that's ridiculous. That our elderly are dying that rate because of overdose deaths. Benzodiazepines are used by approximately 13.5% of older adults. So with adults taking these, or seniors taking handfuls of medication every day, we don't know. We just assume that it's blood pressure and
Yeah.
you know I mean, how many of us are actually reading the bottles and looking? Are they Xanax? Is it dextroamphetamines? Is it, what are they taking?
Well, and I think just from like the clinical perspective, an important one when I talk to families is not dismissing the fact that just because your loved one is older, they're your parent or their grandparent, that's an excuse for what we would traditionally call addictive behaviors, right? So we see a lot of that happen in the clinical setting where it's kind of shirked off as like, oh, well, it was a senior moment, or they're just getting older, or I think they have dementia. You hear a lot of those concepts when the reality is like, well, they may have prescribed medications for some kind of cognitive decline or some kind of mental health issue, but they're also taking that with benzos or they're heavily drinking alcohol. Now, what I would share on the clinical side is if somebody is taking really any types of medication, even ones as safe as psychotropic medications can be, but then they're adding the complication of excessive drinking, you're going to have some dangerous outcomes.
And another viewpoint of family members is, well, he's earned it.
Mm.
He's retired. He put in his work. He should be able to kick his feet up and relax a little bit.
Mm-hmm.
And that combination can have someone dying in their sleep, and we call it natural causes.
So, then, the autopsy report shows that they had their blood alcohol level was through the roof, or they have extremely high recent dosages of benzodiazepines. I mean, this isn't just made up stuff. This is what the research is showing. And as of 2025 into 2026, we see a plateau of only a decrease of 4%, which means that our elderly populations are dying to things like substance use, isolation, under the name of probably chronic pain management and things like that.